So welcome to Workshop 2. What we'll be going through in Workshop 2 is the next part of our segment. My name is Dr. Jahan Mahmoodi. Just to recap where we left off, we realized that we wanted to work in a massive area of developing countries so that syringes weren't used again. We realized our business model didn't support this. Our new syringe, that is a collapsible diaphragm or bladder with a needle on the end, may not be the best thing. So we had to redesign what we wanted to do. We were going to fill this with salt water, saline, and use it in hospitals for a time efficiency process. We felt with our experiments, actually per ward, we could save up to 4 working hours of the day per ward in every hospital in the country, because instead of doing lots of different processes, putting salt water into these syringes, we had them pre-filled. This next part, this next workshop has 5 parts to it. But before I go into that, I just want you to remember another number. Last time it was 4 hours, this time is 46 million. 46 million is the number of saline vials that are consumed within the UK per year. 46 million is the size of our market. Essentially, the business model changed. What we wanted to be able to do is to streamline it. Now that we realize we're not necessarily having to have a needle on the end of our bladder, we just have to have a collapsible bladder that is pre-filled with salt water, saline. Who would be using this? Primarily the nurses on wards that are giving, remember giving is to push fluid, are giving an IV injection, IV intravenous medication into patients. We realized that this would be an inert substance, not necessarily pre-filled with a vaccine. We also felt that our business model may not lend itself for us IEDers to go to market, become a developing company, a manufacturing organization, marketing. So our business model, we're going to be going through how we came to the conclusion that we might be thinking about patenting and licensing and achieving our value through that. So our business model, we felt that as ideas, in the short space of time, we weren't going to be able to become manufacturers and marketers. What we felt our viable business option for gaining maximum value out of this product was to be able to go to patency, prove concept, achieve regulation, and actually license this product out. Remember 46 million vials per year. That's the market we're aiming at. And as I've said, the modifications to our design had to come through. We didn't need the complicated needle anymore because we're not going for the developing market at this stage, so we could lop that off. And here's an idea of what we're going to be having. Our syringe that had the handpiece in which the diaphragm sat, you could get rid of the handpiece now. All you're doing is squeezing fluid through a pre-filled bag into what Robin discussed last time as an intravenous cannula, a piece of plastic that sits in a patient's vein, sits there for you to give them intravenous medication on a regular basis. The design that we came up with eliminated the handpiece and essentially became a collapsible diaphragm that gave salt water, saline, into an intravenous cannula. This is a plastic tube that sits in a patient's vein waiting for drugs to be given through it. But this will save us 4 hours per ward and save us lots of wastage. I'm now going to pass you on to Robin.